Welcome to my video. I have a new story for you. This pharmacist busted a whole hospital supply just by monitoring their prescription. This is the reason why you should always ensure you allow a pharmacist to look through your prescription. So this pharmacist, let's call him Pharmacist Tunde. So 4 patients, different names, different ages, but all of them had the same medicine, diazepam, same dose, same handwriting, and from one doctor in a particular hospital that is close by to his pharmacy. The very next day, a young girl around me, 19 years, also walked in pharmacy with the same drug. He was very, very uncomfortable, but he decided to engage her and say, are you having any sleeping trouble? But she said, not really. I just have small stress and school wahala. So Dr. Femi wrote this prescription for me. So Tunde just noticed, remembered the doctor's name, and then felt, okay, let me just switch it away. But that same week, 2 elderly women came in to pick up their BP drugs. So as Tunde was packing the drug, he overheard them chatting. They were saying something like, that doctor sabi medicine. My pikin when they cry anyhow, he just try medicine for him, make the pikin rest. So he was wondering if the doctor still prescribed diazepam for the child. And then the other woman replied, yeah, my neighbor when they quarrel too much, Dr. Femi give her something for him to calm down. Say the medicine go to help and not they quarrel too much. But he wasn't sure if that was diazepam or something. And then he just switched it away. But he was still scared because he's a doctor and people trust him. It doesn't matter if a pharmacist is trying to correct these people or this patient, they are not going to listen to him because a doctor gave them this medicine. All right. So the next Monday, there's the next week, pharmacist only decided to do a very big thing. So he left the pharmacy early and then he walked to the hospital to find out what the real issue was, probably to also speak with his doctor. So when he got there, he exchanged pleasantries, although he told him that he should wait outside because he was seeing the patient. And then minutes later, Tunde entered. After a long conversation, it seemed that Dr. Femi wasn't happy that Tunde came to interfere in his business. So pharmacist Tunde walked out angry and disappointed. So this passed and Tunde stopped getting the prescriptions. He believed probably Dr. Femi magically turned a new leaf. Maybe he stopped because he attacked him. So the doctor decided to reduce his prescription. Until one day, pharmacist Tunde decided to ask one patient that came from the hospital if she had any other drug that she had bought from the hospital. Like the prescription of this particular patient did not have diazepam on it, but so he just asked out of curiosity, and she said yes. In fact, she brought out sachets, 2 full sachets of bromazepam. She said she bought it in the hospital, and as a matter of fact, she bought it in the doctor's office. She had paid cash, so they were shocked. So the doctor had gotten somewhere where he could buy his drugs, and then they no longer have to bother pharmacist Tunde again. A week later, a familiar nurse came to buy medicine in that pharmacy. She was a nurse who used to work in the same hospital where Dr. Femi worked. So she explained why she left the pharmacist Tunde after he asked. So he writes diazepam for anybody. He even sells it sometimes. One time he get collapsed after taking too much. He just told her mother that it was malaria. But what could pharmacist Tunde really do? Do you understand? Like, what can he do in this kind of case? You know, he's scared, he's worried. If you know what he can do, just drop a comment on the comment section, because I don't think what he did was actually the right thing. So let's go on. So people like Dr. Femi, they have strong connections. Okay? If Tunde reports, pharmacist Tunde's life may be at risk. But here was the easy way out. Tunde decided to draft a report. No names, no accusation, just facts. So he sent it to pharmacy council. Then he waited. 2 weeks passed, 3 weeks, and then nobody acted. So he left the matter. Then one morning, the hospital was sealed up by the Medical and Dental Council. It also happened that Dr. Ajayi had no real license. He had been practicing using a fake license. So even though the Pharmacy Council and NAFDAC did not act swiftly, someone else exposed him because he was using a fake license. So what's the lesson here? Because for those persons who are using fake license, try to be on the low key. You understand? I'm not teaching you how to be bad, but just be on the low key. Don't do things too bad so that you will not be exposed. Then also, as a doctor, people trust you. So try to also reciprocate that trust and give them what is right. Lastly, a quick question. Do you blame people who are afraid to speak up when they see something wrong, especially in the hospital setting? Let me know what you think in the comment section. Thank you. I'll see you in my next video. Bye for now.